Good afternoon, everybody. We'll get started in just a few minutes. Thanks for being here today. If you're just joining us, thanks for joining us during National Food Safety Education Month. We're really pleased to be offering you this webinar today. We'll get started just a few more seconds. See if we have any stragglers that would like to join us. All right, well, let's go ahead and get started, everyone. Good morning, good afternoon, or good evening to you, wherever you are in the world. It's my pleasure to welcome you to our National Food Safety Education Month webinar on the public health challenges of edible cannabis products. I'm Laura Wilde. I'm the Senior Program Analyst in Food Safety here at NEHA, and I am joined by my colleague, Christopher Walker, who is another Senior Program Analyst in Environmental Health. Welcome, everybody. Today's webinar is brought to you by the National Environmental Health Association. Everything NEHA does, we do to build, sustain, and empower environmental health professionals like you so that they're equipped and prepared to protect the health of communities across the country. We are so happy that you have joined us today. If you are not already one of our 7,000 members, yes, 7,000, I hope you'll consider becoming a member. We hear repeatedly from our members how much they value our education and our credentials, and we offer exclusive environmental health and food safety training. We've got nationally recognized credentials that highlight your expertise. We also have an online community that boasts a powerful network of environmental health professionals. And we're always adding to our course catalogs and our resource repositories. So joining NEHA can give you valuable discounts on things like your annual educational conference and exhibition, on study materials and books and courses. And if you're interested in learning more, you can visit our website at neha.org. A bit of housekeeping before we hear from our speaker today. All attendees are in listen-only mode. And as a reminder, this webinar is being recorded and will be made available to you after the fact. Throughout the discussion, you may submit any questions you have in the Q&A box, and we will do our best to answer as many questions as we can after we hear from our speaker. And now, the much anticipated presentation of Matthew R. Swinburne, JD. Matthew is Associate Director for the Network for Public Health's Law. Let me start that again. Matthew is the Associate Director for the Network for Public Health Law's Eastern Team, which is housed at the University of Maryland Francis King Carey School of Law. He is a recognized national expert in cannabis law and policy. His cannabis work includes advising legislators, state and local agencies, law enforcement, community-based organizations, and nonprofits on critical issues related to medical and adult use policy. Appointed by Maryland Governor Wes Moore, Matthew is a member of Maryland's Cannabis Public Health Advisory Council. In addition to his work at the network, Matthew developed and taught the state and federal cannabis law and policy course for the University of Maryland School of Pharmacy's MS in Medical Cannabis Science and Therapeutics program. The course is one of the first of its kind in the country. He is also an attorney advisor for the University of Maryland's Public Health Law Clinic and has taught public health law and ethics for the University of Maryland's School of Public Health. So if you're wondering if you're in good hands, you are. And at this time, Matthew, I will pass it over to you. Thank you for joining us.
Thank you for having me. And I really hope that I can live up to the introduction. And the first test of that is going to be my ability to share my slides. Now, Laura, can you see my slides?
We sure can. Thank you.
Awesome. Okay. So before I get into the discussion of, addressing the public health challenges associated with edible cannabis products, I'm going to tell you a little bit about the organization I work for. So the Network for Public Health Law, we are a nonprofit that is primarily funded by the Robert Wood Johnson Foundation. And we have attorneys across the country, and we specialize in a lot of major public health issues. And we are here to support people working in the field of public health. So, if you have questions related to public health law, we may be able to help you. And, a lot of our services are provided free of charge. So I have my contact information at the end of my slides, which will be made available to you. And obviously, my area of expertise is cannabis law and policy, but my colleagues deal with a lot of other important issues as well. Now, law and policy in the area of cannabis is changing rapidly. And looking at this map, which shows kind of the distribution of states that have legalized cannabis, most Americans live in a jurisdiction that has legalized cannabis for at least medical purposes. And at least, 23 states and DC have legalized it for adult use, which, is often called recreational use as well. So probably the majority of folks on this webinar are in a state that has legalized cannabis, either as a medical product or as an adult use product as well. Now, the product we're concerned about today are edible cannabis products. And I've included, I think everybody has an idea, but I've stolen some language from some regulations that I think are, just kind of clarifies what we're looking at, And edible cannabis products are big business in the United States. Now, last year, the legal cannabis market was valued at around 30 billion. Now, edible cannabis product sales accounted for 10, 11, 12%. I'm a lawyer, not a math teacher. So that 3.4 billion in edible sales last year. And it's actually like edibles are the third most popular product behind cannabis flower, vape, and then edibles. And then you can kind of see the distribution within edibles of what edible products are the most popular. With candies, edible, cannabis infused candies being the most prevalent in the country, looking at things like the cannabis gummies, hard candies, those type of products. Now, we've got this really popular product that, beyond just being a cannabis product, has some unique challenges that, folks in the public health realm, have concerns about and have worked to try to address. And there's three major areas of concern with cannabis edible products. And the first is dosing issues. And we'll look at some of the approaches to dealing with this problem, but states, when they first started legalizing cannabis and allowing the sale of edibles, did not have a lot of important safety measures in place. And so dosing was a really big issue. Now, the first challenge is that consuming an edible cannabis product interacts with your body differently than smoking or vaporizing cannabis. And so folks who are used to smoking cannabis, will experience the intoxicating effects within 15, 20 minutes. With edibles, because they go through a different metabolic pathway to get into the system, it can take 2 or more hours for the intoxicating effects to take place. And so you can imagine someone who is, new to cannabis or new to using cannabis edible products, takes a bite, isn't feeling anything for 20 minutes, takes another bite, still not feeling anything, takes another bite. And so by the time the edible cannabis product kicks in, they've taken in a very large dose of THC, the primary intoxicant in cannabis, the cannabis plants and cannabis products. So that delayed onset creates issues for dosing, and also the issue of how potent these products are. And so what I've provided on the right is an example. The Elvis, this cookie is based on the famed fried banana and peanut butter sandwiches of the king of rock and roll. And you can see the Elvis, that cookie contains 1,000 milligrams of THC. That is a ridiculous amount of THC. To give you an idea, most states will place a THC cap per serving of around 10 milligrams in the adult use market and limit a container to around 100 milligrams of THC. So this is an absurd amount of THC, and nobody eats, in this case, like, what would that be? 1/100th of that cookie to get a 10 milligram dose. So when you have really high potency products, it just exacerbates the problem with dosing. And, kind of tied to that is, unless the products are designed well, it can be a challenge to determine what is the appropriate serving size. And so we've got all of these factors kind of playing together. And kind of the last issue that we have with kind of that THC dosing from an edible is, making sure that, with the infusion of these food products, that the THC is uniformly distributed within the product. So we don't have someone, taking a gummy that has no THC, but then, the other gummy is more than that considerably, or, even with something like the cookie, you have very powerful bites and then non-existent bites. So that's the first issue we're going to look at. The second, I think, is pretty obvious, and that is these are products that are attractive to children, especially young children. Cannabis flower is less likely to be accidentally ingested by a 5-year-old than a cannabis edible that looks like a gummy bear. And the other image I included is from I believe the Denver police force, something they put up on a billboard, just driving home the point back when Colorado still hadn't put restrictions in place, that shows an edible and an ordinary piece of candy. And, just kind of drives home the point that, a child isn't going to be able to tell the difference. And we see that play out with legalization and specifically when states begin permitting the sale of edible cannabis products, there's an increase in accidental ingestions, which lead to increased poison control calls and hospital visits to deal with, this challenge. And then the third thing we're going to look at is probably the area that you guys are most familiar with, and that is, legally these aren't food products, and we'll talk about that, but they present a lot of the same food safety issues in terms of foodborne illness, food allergens, and adulteration. So these are the issues that we're going to look at. And moving forward, I'm going to look at different policy approaches that are used to try to address each three of these challenges. And every state's regulatory system is different. There are some general policies that we'll look at that are fairly widespread, but there is always a bit of variation. So I'll provide a couple of examples, but to be able to speak to the specifics of your state, I probably have to talk to you offline. All right, so the first issue of dosing issues. there's just common sense regulations that states start to put in place. And I've kind of alluded to some of these. The first is, not allowing a product like the Elvis cookie to be in your market to begin with, and setting serving limits and package limits for THC. And, here I've listed for the adult use market, the most prevalent limits are what I mentioned earlier: 10 milligram maximum per serving and 100 milligrams of THC per package. And so we have these blood orange turmeric gummies, each gummy being 10 milligrams and only being allowed to have 10 of those gummies in the package. Now, one of the issues that you'll see is that these potency restrictions aren't always applied to the medical market, because there may be medical patients who require a higher potency product to get the medical benefits. So some states don't place potency restrictions at all on edibles for medical cannabis patients versus the recreational users. And some states, like for example, my state of Maryland, edible cannabis products are limited to 10 and 100 for the adult use market, but for medical patients, they can get edible products that are as powerful as 40 milligrams of THC per serving and up to 400 milligrams of THC per package. So we have, some difference between the adult use market and the recreational market. Now, my slides will be available later. The line that I have highlighted in red takes you to some research that I did with my team, where last year in 2022, we looked at all the adult use markets and looked at the potency restrictions that they had in place. So if this is something you're interested in, you can link to that research off of these slides. Now, we're going to talk about product testing a little later, but one of the things that we talked about is the homogeneity of THC in the product. And best practice, and states all require this, is they have to make sure that THC, the producers of the product have to make sure that the THC is uniformly distributed within certain kind of degrees of error. And that's one of the things that is normally tested for on these products. Now, again, a lot of this is common sense. From a product design perspective, if you're going to have something like a chocolate bar that is 10 servings, have clear demarcations so the person knows, breaking off one square, like the image is one serving. And another approach that states take is like, if having each serving be individually wrapped or clearly separate, like that gummy is clearly separate from its 9 siblings that are in that package. So it's just some basic common sense packaging and design there. Labeling, requiring, and every state does this with licensed cannabis products, requiring the potency information on the product so the consumer has that information available. And also, states require in the packaging and the labeling that there's a warning for users about the delayed onset. So warning that, the intoxicating effects of this product may take up to 2 hours or more to take effect. And also, I think, which is a big tool for public health in general, is just consumer education. As states legalize, people are going to be new to using these type of products or new to using cannabis at all. And so it's really important that as a harm reduction strategy, that states use that education about safe use of edible products. Now, moving on to the issue of the attractiveness to children. So I'm going to talk a little bit about product design, and you see the red highlighted section at the top. that links to some research about, state restrictions on edible cannabis products, if you're interested. Again, research out of 2022. But again, a lot of this is common sense. Every state has a general prohibition on edible cannabis products appealing to children or being attractive to children. And so you have this general language, and they'll often include, the types of variables that they're concerned about, whether it's the shape of the product, whether it's, something in the design of the product, the flavors. And so something like these gummy edibles at the bottom that look like gummy worms, those are attractive to children. They also, are going to violate some other prohibitions that states use. But some states go beyond just saying, like, you can't have your products attractive to children. Some states say your edibles can only be in geometric shapes. It can only be a cube, and it can only be a diamond. It can only be a sphere, and it can't be a gum, and that's like the gummy bear response. Like, so you stop having gummy bear edibles and gummy worm edibles, and, states adopt that type of policy where they really restrict the shape. And, you have these prohibitions. But another issue, and we see it in the upper image on the right, is states will explicitly prohibit the products from being modeled after essentially food products, non-cannabis food products that are primarily marketed at children. So if you are doing a Sour Patch Kid knockoff, that's violating this type of prohibition, but would also, violate the prohibition on general attractiveness to children. But in kind of the earlier stages of cannabis legalization, before these basic policies were adopted by some states, you were seeing just these like knockoff cannabis products, the Sour Pot Kids, Reese's Pieces, peanut butter cups with, packaging that looked very similar to the actual product, but really trying to play off kind of the brand awareness and of these, non-cannabis products. So the next thing we'll look at in terms of the children is packaging. And this is very similar. And we're going to kind of see the range of packaging restrictions that states put in place. First of all, every state that allows edibles requires child-resistant packaging, or, and a lot of them, reference the federal standard on that. So, that's the idea of we're trying to prevent accidental ingestions by making it more difficult for the child to actually get into the package. And again, we have a prohibition on the packaging being attractive to children. Most states will say, the packaging itself has to be opaque so they can't see the edible product to try to decrease the attractiveness of it. But some states have gone beyond just saying, your product can't be attractive to children. Some create what we refer to as plain packaging requirements, basically saying your packaging can only be one color, you can't have any images or trademarks, the information that you have on your packaging is really limited to the name of your company and all of the required warnings and labeling information. And that's an approach that, for example, is taken by the state of Connecticut. With these, their packaging, there's warnings about keeping it out of reach of children. Most states will have what they refer to as a universal symbol, where it's essentially, helping adults also, prevent accidental ingestion by adults, have this cannabis leaf symbol or a THC symbol on the packaging to try to drive home the point that these are cannabis edibles. And, another safety measure that a lot of states require is poison controls number on the package itself. Now, looking at the right, Laughing Monkey grape candy is going to violate, I believe, every state's edible regulations at this point, because we have the use of this cartoon character. The name is Laughing Monkey. This is something that would be deemed attractive to children and an type of illegal packaging. Now, the packaging below would be legal in some states that don't have what I referred to before as that plain packaging requirement. They're not using cartoons, it's toned down a bit, and I think that may be a product I pulled from a dispensary in New Jersey, which has a pretty standard packaging restriction. And the product at the bottom, that packaging looks more like prescription medicine. And that is packaging that meets Connecticut's plain packaging standard. So you can see the variation in trying to decrease attractiveness to children. Now, we're going to kind of move on to policies that look at dealing with that issue of adulteration. There are other interventions or policies that we'll look at, but the first thing I want to talk about is the testing of cannabis products. And, with legalization, one of the arguments is that legalization is a harm reduction technique, because the products in the illegal market have no product testing from a safety perspective. You will never find, products in the legal market that have been adulterated with fentanyl. And we're going to kind of look at the basics of kind of the cannabis product testing regime that states use. So before any cannabis, whether it is cannabis flower, cannabis concentrate, vape product, cannabis vape or cannabis edible, all these products have to go through the state's testing program before they can be dispensed or sold to the end customer. Now, the majority of states use independent testing labs. So it's not, a state lab that is doing the testing, but it is an independent lab that has to either be licensed by the state or certified by the state to perform the mandated testing of cannabis and cannabis products. Now, every state requires these independent testing labs are accredited by a major, organization. And so here are just some examples of accrediting organizations. And these are the organizations that Arizona accepts for their independent testing labs. Now, the number of testing labs varies from state to state. And part of it is, the capacity and size of the testing labs and the size of the state's cannabis market. And so I give you an example. In Maryland, we have 5 independent testing labs, whereas Arizona has 14 independent testing labs. Now, where does and the next slide, I'm going to talk about the type of things that are tested for, but when in kind of the production process are products tested? And so depends on the product. If you have cannabis flower, that testing can be done from batches produced by the grower, the licensed grower, before they transport their product to dispensaries or to a processor if it's just for packaging. But if in the creation of edible products, a lot happens to them after the growing stage. And so you may have a system where the testing is done after the product has been created by the licensed processor, but you will always have the product tested before it can be dispensed. Now, what are they looking for, these independent testing labs? Now, this is an area where there is not uniformity between states, but we can talk about general categories of things. So as we talked about earlier, potency is an issue. So states always test the potency of a batch of cannabis or the potency of the batch of edibles. And when we talk about potency, we talk about THC. And there are several forms of THC, but states also require other cannabinoids. So cannabinoids are just the naturally occurring chemicals in the cannabis plant. So, most folks are familiar with CBD, cannabidiol, which, we'll talk about a little later, but it's testing for the concentrations of these specific chemicals in the product. They test for homogeneity of these. They're testing for microbials and mycotoxins, heavy metals, pesticides, fungicides, growth inhibitors. And, for edibles, they're also going to be testing for solvents, because solvents are used in the processing from flower to the various products that are made from that cannabis flower. I provided you a link if you're interested to kind of look at the different analytes and maximum allowable concentrations for those analytes from Arizona. But one of the challenges we have is that, because cannabis is still legal at the federal level, we don't have federal testing standards for cannabis edibles or any really cannabis product. And as a result, each state is developing their own program. They're learning from each other, but you do see variation between states. Some states, will even vary their testing protocols depending on the type of product, whether it's flower versus edible. And one of the issues that I'm seeing is I'm working with a scientist out at Arizona State University who's studying the testing protocol, because Parkinson's patients, and in most states, someone with Parkinson's can obtain medical cannabis. These folks are particularly sensitive or vulnerable to some of the kind of risky contaminants that are being tested for. And so trying to understand, whether or not the testing protocols for these elements are safe enough for the medical cannabis patients. Now, one of the things that is becoming an issue, and I think is a really important thing for states to look at, is this idea of state reference labs. This is a policy that not every state has. And so, I think of this as, simply who's watching the watchers, who's, verifying the work of these independent testing labs. And so states are starting to put in place state reference labs. And I kind of, Maryland, when we legalized adult use and had our Cannabis Reform Act this year, one of the things that was put in place was a state reference lab. And so I'm going to just kind of run down what Maryland has done, because it highlights the importance of these type of labs. First of all, it's going to be a reference library in terms of, testing methodologies that, the independent testing labs, being a reference for them in the work they need to do. In Maryland, they're going to, our state reference lab is going to be creating standard operating procedures for different tasks for the independent testing labs. And they're going to provide 3 really important testing services. The first is proficiency testing. So they're going to test the labs to see if they can, get the correct result when testing a sample that the state provides. So, making sure that they are proficient in the tasks that are required of them when they're testing cannabis. So they're doing this initial proficiency testing, but also, kind of after the fact, the state reference lab will also be doing compliance testing. So after products are out on the market, testing these products to make sure that, essentially they have met the safety standards, the potency information reflected on the label is indeed accurate. So there'll be that level of kind of monitoring with some compliancy testing, but also in a very kind of traditional public health sense, when there is an adverse event associated potentially with an edible cannabis product, doing that adverse event testing for the state and helping, kind of do the traditional public health response in that area. So this is something that, if your state doesn't have one of these, I would suggest they look at this, because I think it is a really important safety tool in this area. All right. You guys are all experts in food safety. I am not, but I understand, kind of the basic approaches that states have done to try to deal with the food safety aspect of these products, because there's a bit of a legal challenge that requires just jumping through a few hoops, because these products have cannabis in them, they don't qualify as food. They're adulterated. And so they're not automatically covered by federal, state, and local food safety laws because they're an adulterated product. And so states, there are two basic approaches to this. And the first approach that you see in a lot of states is, the state will pass a law that basically says, all right, we know these aren't technically food, but edible cannabis products are subject to, state, food safety standards, federal food safety standards. And, I gave an example of Maryland here. Although edible cannabis products are not defined as or regulated by the same approving authority as food, you've got to comply with, and I listed some of the, the relevant food safety laws that edible products need to comply with in Maryland. So that's kind of, one of the major approaches that states take. And some states, and I'm giving the example of Nevada here, start to create new food safety standards that are specific to edibles. Of course, these standards, are reliant on, existing food safety standards, and the information there, but it's just dealing with the legal challenge of adulteration. And so, Nevada says, you guys, processors, you're not subject to the same standards as food establishments. However, you've got to have someone on staff, who has, got the local health authorities food handler training, and we're establishing our own food safety regime that looks at those major categories that you would see in any food safety regime, but they are specific to edible cannabis products. And, these aren't clear lines between these two approaches. I think you will see some blurring where, some, food safety standards, unique standards are created in combination with, a reliance on existing protocol. Okay. Now, some additional, keep checking my watch because I know I talk a lot, some additional, food safety related measures that we see with edible cannabis products is like with food products that pose, additional food safety challenges, with the constituent food that's being infused. Some states just prohibit that. So prohibiting, meat, seafood, unpasteurized eggs, unpasteurized dairy. from being infused with, cannabinoids, THC. We're probably all familiar with Four Loko, that product that was created years ago that was high alcohol, high caffeine, that created health problems, especially for young people, college-age students who were drinking this. So this issue of, the mixing of intoxicants or chemicals. There are states that ban alcoholic beverages from being infused with cannabinoids to prevent kind of the cannabis equivalent of Four Loko. And another issue that you see in a lot of states is the prohibition of just adding cannabis concentrate to a commercially available food. So that would be like, all right, we're going to make cannabis cocoa pebbles. And we're going to do that by, basically spraying cocoa pebbles with THC and then repackaging them. And again, that goes to, I think a big part of that is you traditionally see that practice done to foods that are attractive to children. And so states will prohibit that. And I alluded to this earlier already, states will prohibit synergistic additives. So we're worried, not just with alcohol, but, adding nicotine and caffeine to these products to, potentially, affect the potency and toxicity of the product. And with caffeine, usually, there is the cutout for naturally occurring caffeine, so that coffees, teas, chocolates are still permissible within the edible cannabis product regime. And, some more common sense regulations like, allergen listings, all these food allergens, the 8 primary, have to be listed on edible cannabis products, even though they are not technically food because they're the adulterant of cannabis. And there's other common sense, measures like ingredient listing requirements and, just a lot of other kind of traditional food safety approaches with these. Now, the last thing I'm going to talk about, and it looks like I have about 7-8 minutes, is hemp. Because everything I've talked about up to this point are edible products within the licensed cannabis markets, the businesses that get licenses from the state to be able to sell cannabis products. But you've probably seen THC products and CBD products and Delta-8 products, being sold at gas stations, being sold at smoke shops, being sold at, tobacco retailers, health food stores. And they look a lot like the products that are being sold in our licensed dispensaries that, are subject to much stricter regulation. And the reason we see this is because of hemp. And hemp was legalized by the U.S. Farm Bill in 2018. And it was legalized as an agricultural product, meaning folks could grow the plant, and then move that on to be made into different products. Now, at the time, Congress was really thinking like, oh, this can, hemp's got all these different uses. It can be used, in foods, it can be used in fibers, it can be used for bioplastics, and it can be used for CBD products, which, CBD, is used in wellness products and some medicines, but, it is not an intoxicant the way THC is. But unfortunately, Congress didn't understand math or science when they drafted this law. And it really goes into how they define what hemp is. So I provided a part of the definition, and they're saying, essentially, it's this low potency cannabis plants that can have no more than 0.3% by dry weight of Delta-9 THC. So they're saying it's a low potency. Now, normally the cannabis plants that are used to make, licensed cannabis products have a much higher delta-9 THC concentration than that. And they say, it's the plant that has this low concentration by dry weight, and basically any product derived from that plant. That's hemp. And it's not cannabis, which is a prohibited Schedule I drug under federal law. Now, when they legalized the plant for agricultural purpose, the growing of the plant, they said, FDA, you have your normal authority to regulate any products made from that plant. Well, the FDA really hasn't done anything other than, issue a couple warnings when hemp companies make unsubstantiated health claims, which would make them an unapproved drug. And, they've put out general warnings about some of these hemp-derived products. And so why is this a concern? Well, the science part, we'll talk about, Congress not understanding science. THC comes in many different forms or isomers. Delta-9 is what's found in the highest concentration naturally in the cannabis plant. But there are other types of THC that are found, but in just infinitesimally smaller concentrations naturally in the plant, like delta-8. However, through the magic of science, you can convert CBD essentially into any form of THC you'd want. So you can make delta-9 THC from CBD. You can make delta-8 THC from CBD. And so they didn't understand that when you include all the derivatives from this product, you're actually enabling the creation of really high potency products. Now, these isomers, well, what's the difference between delta-9 and delta-8? And the difference really with these isomers is their chemical structure. And that different chemical structure binds to the receptors in our brains differently. So delta-9 is more effective at binding to those receptors than delta-8. However, you can see on the bottom right, I have some delta-8 gummies, 1,000 milligrams in that. So, it's believed that delta-8 binds half as effectively as delta-9. So if we were to try to figure out the equivalency, that would be 500 milligram equivalent, delta-9 THC, which is a very high amount of delta-9 THC from a hemp product. Now, that's not understanding science. Now, not understanding math, when you apply 0.3% on a dry weight basis, not just to the plant, but to its derivatives, you can get really high potency products, even if you're just going delta-9. So Snickers bar weighs around 50 grams. Apply that restriction of 0.3%. That's 150 milligrams of delta-9 THC in a Snickers bar, and it can be a hemp product. So you can see these products pose the same public health concerns as products made from cannabis or marijuana in our state's regulated systems. But the federal government hasn't created any safety protocols or federal standards for these new products. So states are really piecemealing this. And they're slowly recognizing that these hemp-derived products need to be regulated. And so some states, like New York, have created a separate regulatory system, licensed regulatory system for hemp products that uses the safety, the similar, kind of public health interventions that we've already talked about in terms of potency restrictions labeling, packaging, product design, product testing. Some states say, okay, if you're creating a hemp product with THC, it's got to be sold in our existing licensed cannabis market. You can't sell those products unlicensed. And other states have no regulation of these products whatsoever. And it really runs a spectrum of how well these are regulated from a product safety standpoint. So when people tell me, the dispensary, can gas stations be dispensaries in the cannabis system? I'm going, no, these gas stations aren't selling regulated cannabis. They're selling hemp products. And it really goes down to like how stringent your state is on regulating these products that present all the same risks we talked about with our traditional cannabis edibles. And that is my last slide. Oh my gosh, Laura, I was close to the 50 minutes you told me.
You did great. You were right on time, sir. So thank you. Thank you. Thank you. I feel like my head is spinning with questions and so much information that you provided.
I know we have just a little time, Laura. If we don't get to anything, please send me the questions and I will do my best to answer them and get them back to you.
Absolutely. Yeah, let's dive into questions. So the first one comes from Sharon Unkart. Now, I think you covered this, Matt, but if not, feel free to elaborate. So she said, the Elvis cookie you showed is labeled as medical cannabis. Aren't their dosing limits much higher than the 10 milligram limit?
In some states. But the challenge we had is that early days, there weren't these potency caps in the medical or the adult use, and states have been, as states progress, putting these caps in place. So in most states, and in fact, every state I've looked at with an adult use program, you could not get the Elvis cookie anymore as an adult use or recreational user. But in states that have no caps, like Arizona has no THC cap for medical patients, the Elvis cookie, if developed in their state, could be sold in their state. But in my state, that product is still too powerful for the medical market because we have the 400 milligram cap for medical products. So it really depends on your state's regulatory system.
Really varies. Got it. Okay. Well, let's switch the conversation over maybe to labeling. Does labeling, in your experience, what you've seen, does that include the type of strain used to make the edible cannabis?
Yes, sometimes it includes strain, but a lot of folks that I talk to, the strain information in cannabis nerds, if I don't correct myself. So when we talk about strains, we're thinking of, like microorganisms. With cannabis, it's cultivars rather than, because cannabis nerds get mad at me when I don't say that. But people I've talked to, that information, in a sense, is more for marketing purposes. The critical information that's on that label is going to be the testing results related to the cannabinoids, and then there's another category of chemicals that are found in the plant, terpenes. Some states test for different terpenes, which have different effects. And so the important information is more that testing data than saying it's cannabis sativa, cannabis indica, which is more, I think, for marketing purposes. But some states, do require that type of information on there.
Thanks for that question. At the risk of pronouncing your name wrong, Shepo, maybe? Thanks for that question. Let's move on to one from Monique. Now, this might be a little bit of a discussion topic. We've got about 5 minutes left.
Okay.
So we're winding down on the clock, but can you discuss the use of distillate in actual food items in a restaurant?
Okay, so the idea, this is, I think, again, this is complicated. So, and we have issues with people. We've got that hemp. So I'll talk about what's allowed in the cannabis regulated markets. So there is a new license type that states are creating, essentially consumption sites, places where people can consume cannabis and cannabis products in public. So think of a cannabis cafe. And every state that allows these regulates them differently. And in some states, and I think the smartest policy is they only allow those cannabis cafes or consumption sites to sell pre-packaged products. So pre-packaged cookie, pre-packaged gummy, pre-packaged pre-rolled joint, pre-packaged, whatever product. And some states, and I have to go back and look, the issue of allowing them to actually infuse food with cannabinoids on site, I think most states prohibit that. And because of the safety issues with that. And we've got the issue of hemp. I've seen in my home, not my hometown, but my adopted hometown of Baltimore, before our new Cannabis Reform Act came out, there were cafes infusing coffees and baked goods that they were making at their bakery with cannabinoids. And so they were doing that with hemp-derived cannabinoids, which, is, another example of this kind of loophole that hemp created for folks, because it, chemically and functionally, if you can get, 100 milligrams of THC from distilled from the hemp plant, it's going to function the same as 100 milligrams from the cannabis plant. But I know it's been a problem in a lot of jurisdictions where people are exploiting the legalization of cannabis, as well as the issue with hemp, to create these kind of weird, on-site infused products, which are probably problematic under existing regulatory schemes, unless, your state really doesn't have much to do with hemp regulation. I hope that answered the question, but I could talk about that for a while.
Yeah, I'm sure. I know we could go on, and there are still 2 questions
Okay.
on the board, but I don't think we're going to be able to get to them because I'd still like to do my wrap up and to thank you, Matt. So Marlena and Robert, what we'll do is we'll take these questions that you have, and I'm going to send a recap email to everybody that's going to have the slides. It'll have a link to the recording, and it'll answer these 2 questions for you because we don't want to leave you hanging. But let's go on to our closing slides. And Matthew, in the meantime, if you want to type your answer, by all means.
All right.
So everyone,
yeah, these are classics.
Yes. So if you all found this webinar valuable, we have a lot more like this, a lot more cannabis focused tracks at our annual educational conference and exhibition. Next year's AEC is in Pittsburgh in July. So our focus is going to be on discussions and presentations about environmental health moving into the future. So if you're the presenter type like Matt and I are, abstracts for the 2024 AEC are open and they close October 9th. So with that, our time has come to an end, and I'd like to thank you, Matt, so much for sharing such great information with us on the public health challenges of edible cannabis products. Thank you to our attendees for joining us today. Keep an eye out for our survey so we can continue to provide valuable information and make it better for you all in the environmental health workforce. So thanks again, Matt. Thanks, everybody, and be well. Thank you.